"He'll die in 5 minutes without intervention," Dr. Sofia Mendes said with unwavering resolve. With a worn stethoscope and steady hands, the once-scorned military surgeon confronts Beverly Hills medical elite. When an earthquake devastates, Los Angeles and high-tech equipment fails. Only her battlefield techniques can save the oil tycoon impaled by metal. Elysium Hospital stood like a monument to luxury medicine atop a hill in Beverly Hills. Its mirrored glass facade reflected the California sun, while its white towers gleamed like beacons for the privileged. In the main lobby, a waterfall cascaded over Italian marble, surrounded by rare orchids. The wide, silent corridors were traversed by doctors in impeccably white coats, carrying state-of-the-art tablets. Elysium's rooms resembled presidential suites in 5-star hotels, offering panoramic views of the Pacific Ocean. On the rooftop, a helipad received private jets bringing patients from all corners of the globe, multinational CEOs, Hollywood stars, royalty. It was the hospital where every treatment cost as much as a mansion, where even the nurses wore designer shoes, and where the doctors were all graduates of the world's most prestigious medical schools. In the main conference room, Dr. Alexander Pierce, Elysium's chief medical officer, adjusted the silk tie under his lab coat before addressing the assembled team. "Ladies and gentlemen, as you all know, we are facing a delicate situation with the unexpected departure of Dr. Whitman. The administration has decided to temporarily hire a surgeon to cover the trauma department until we find a permanent replacement who meets our standards." He paused, clearly uncomfortable. Given the urgent circumstances, we had to make a somewhat unconventional hire. The conference room doors opened, and all eyes turned to the woman who entered. Dr. Sofia Mendes didn't look like she belonged there. Of average height, with skin tanned by the desert sun and brown hair pulled back in a simple bun, she wore a visibly worn lab coat over practical clothes that contrasted sharply with the designer attire around her. In her hand, she carried an olive-drab canvas medical bag with faded stains and patched seams, clearly repurposed military gear. In her coat pocket, an old stethoscope was wrapped with black electrical tape at one end. Around her neck hung a chain with 2 military dog tags. "This is Dr. Sofia Mendes," Pierce continued, his tone almost apologetic. "She served as a combat surgeon in the army for 12 years, including tours in the Middle East and Africa. She recently left military service." Sofia stepped forward, her upright posture betraying her military training. "Good morning, everyone." Her voice was calm but firm. "I'm here to assist in any way needed." As she spoke, her eyes swept across the room, assessing everyone present with an analytical gaze that seemed to unsettle several doctors. A middle-aged man with Italian-framed glasses stood up. "Dr. Elliot Ramsey, head of cardiothoracic surgery. Dr. Mendes, do you have experience with minimally invasive mitral valve procedures using the Da Vinci Enith robotic system?" "No, doctor. On the battlefield, we didn't have robots. When we needed to open a chest, we used whatever was at hand and our own skills." Subtle laughter rippled through the room. A perfectly coiffed blonde doctor smiled disdainfully. "Dr. Natalia Kovic, surgical oncology. Fascinating. And which university did you graduate from, dear?" "Federal University of Rio de Janeiro, with a residency in trauma at the Army Central Hospital. My advanced training came primarily from field hospitals in conflict zones." Sofia replied without hesitation, her face remaining impassive in the face of the condescending tone. "So no Ivy League, no fellowship at renowned institutions?" asked a young plastic surgeon, Dr. Jason West, adjusting the cuffs of his shirt under his lab coat. "An interesting choice, Dr. Pierce." The director cleared his throat. "As I said, this is a temporary solution while we search for a suitable replacement. My uncle, Colonel Roberto Mendes, always said that real doctors don't need marble floors to save lives," Sofia commented casually. "He taught me how to perform a tracheostomy with a ballpoint pen and a Swiss Army knife when I was 16. The silence that followed was almost palpable. The next morning marked Sofia's official start at Elysium Hospital. She was walking down the hall towards the emergency wing when she heard her name called. "Dr. Mendes, we have an emergency in room 502. Sophia followed the nurse to the room where an elderly patient was being treated by Dr. Ramsey and Dr. West. "Just a simple allergic reaction," Ramsey explained dismissively. "We're administering epinephrine and corticosteroids. We'd appreciate it if you could observe and learn our protocols." Sophia approached the patient, immediately noticing the progressive swelling in his throat, labored breathing, and rapidly spreading red patches. "This isn't a simple allergic reaction," she intervened. "It looks like hereditary angioedema. Epinephrine won't be enough." "Absurd," West retorted. "It's clearly antibiotic-induced anaphylaxis. We've already administered the standard treatment." Sophia quickly checked the chart. "There's no history of allergies here, but there is a record of coagulation problems in the family. We need C1 inhibitor concentrate immediately, not corticosteroids." "Listen," Ramsey interrupted, raising his voice as several nurses and residents watched the scene from the hallway. "I don't know how you did things in makeshift field hospitals, but here we follow evidence-based scientific protocols, not battlefield hunches. And we have a VIP patient here," West added, referring to the elderly man who was a renowned Hollywood producer. "We can't experiment with alternative treatments based on intuition." The patient began making choking sounds as his face swelled visibly. "You're going to kill him," Sophia said calmly but with authority. "If we don't treat the hereditary angioedema now, he'll have a complete airway obstruction within minutes." "That's enough," Ramsey exclaimed. "Dr. Pierce will be informed of your insubordination. Please leave this room immediately." The onlookers in the hallway stared intently as Sophia was practically thrown out of the room. As she passed through the door, she heard West mutter, "What did we expect from someone who learned medicine in desert tents?" 3 days later, Elysium Hospital faced its biggest crisis in decades. A magnitude 7.2 earthquake had struck Los Angeles, causing the partial collapse of several downtown skyscrapers. The hospital was overwhelmed with casualties, many of them VIP patients rescued from a luxury hotel that had partially collapsed. Amid the chaos, Sophia worked methodically in the makeshift emergency wing, organizing patients by severity and establishing an efficient triage system that contrasted with the surrounding panic. "We need more O-negative blood," shouted a nurse. "We're out, the blood bank is depleted and the roads are blocked." Another replied. Sophia stepped forward. "Set up a volunteer collection point right here. Start with non-essential staff and families. Of less critical patients. Use the cafeteria as the collection area." Dr. Pierce rushed back and forth, visibly overwhelmed by the scale of the emergency. "The system is overloaded. The diagnostic equipment can't handle the demand." "Dr. Pierce," Sophia called out calmly, "we need to prioritize. Head and chest trauma first, then open fractures. Assign fixed teams by injury type, not by patient." "That's not how we do things here," he replied irritably. Just then, the lights flickered and went out. The emergency generators kicked in, but several sophisticated pieces of equipment shut down permanently. "The CT scanners are down," someone shouted. "How are we going to diagnose head traumas?" "Manual neurological exam," Sophia answered promptly. "Pupillary response, reflexes, consciousness assessment, like we do on the battlefield." An explosion was heard outside. A gas line had ruptured near the hospital. Seconds later, paramedics rushed in with a stretcher. "We have a VIP victim, oil tycoon Mr. Harrison," one of them yelled. "Penetrating chest trauma from a metal fragment. Vital signs critical." The Elysium doctors rushed to attend to the billionaire, but froze when they saw the roughly 20-centimeter piece of metal piercing his chest. "We can't remove that without a CT scan," Ramsey said, pale. "We need to know exactly what's been punctured before we intervene." "He won't survive until the CT scanner is fixed," Sophia replied, approaching the stretcher. "The fragment is too close to the heart. So what do you suggest?" "Blind surgery," challenged Natalia Kovic, who had arrived with her surgical oncology team. "That's madness." Sophia placed her worn stethoscope on the patient's chest, closing her eyes to concentrate deeply on the sounds. After a few seconds, she opened her eyes. The fragment pierced the pericardium but missed the right ventricle. "There's blood accumulating in the pericardial space, causing cardiac tamponade. We need to drain it immediately and then remove the fragment." "How can you be sure of that with just a stethoscope?" West questioned, incredulous. 5 years listening. To hearts in desert tents with explosions in the background taught me to distinguish every abnormal sound, Sofia replied, already scrubbing in. We'll need a pericardiocentesis kit. We don't have that specific kit here, a nurse informed. Sofia glanced around the room, quickly assessing the available supplies. Bring me a 50 ml syringe with an 18-gauge needle, a central venous catheter, scalpel, needle holder, 2 Waniro silk suture, sterile gloves, and povidone iodine. The team watched, stunned, as Sofia prepared her improvised surgical field. Dr. Pierce started to protest. This is against all our protocols. We can't allow a procedure without the proper scans. He'll die in 5 minutes without intervention, Sofia replied as she pulled on sterile gloves. Dr. Pierce, do you know any other doctor here who has ever performed a pericardial drain without fluoroscopy? Silence was her answer. I thought, not. Now please either watch or leave the room. A tense silence fell over the medical team as Sofia precisely located the needle insertion point. With sure, precise movements, she inserted the long needle into the pericardial space, quickly, connecting it to the syringe. To everyone's astonishment, bloody fluid began to flow into the syringe. Cardiac tamponade confirmed, she announced, swapping the syringe for a larger catheter. Now let's stabilize his vitals before removing the fragment. The monitors began to show improvement in the patient's vital signs as the blood drained from the pericardial sac. The patient's breathing became less labored, and his blood pressure started to normalize. That's impressive, murmured Dr. Kovic, watching intently. Now comes the hard part, Sofia said. We need to remove the fragment without causing further damage. I'll need someone to prepare 4 units of O-negative blood and a vascular suture kit. Impossible to do that without cardiopulmonary bypass, Ramsey protested. Any massive bleeding would be fatal. In Kandahar, I removed artillery shrapnel from soldiers' chests using only a flashlight and forceps, Sofia replied calmly. The difference is that here we have decent anesthesia and better lighting. Without waiting for further protests, Sofia began the procedure to remove the metal fragment. Her movements were precise, almost choreographed, as she worked with simple tools to solve a complex problem. The entire room watched in reverent silence as she delicately manipulated the foreign object, avoiding vital structures with pinpoint accuracy. After 20 minutes of extreme tension, the fragment was removed, and Sofia quickly sutured the damaged vessels. The cardiac monitor showed stable and improving vital signs. Patient stabilized, she announced, removing her bloodied gloves. He'll need broad-spectrum antibiotics and continuous monitoring, but he'll live. The room erupted in spontaneous applause. Nurses, technicians, and even the doctors who had previously ridiculed her. Sofia simply nodded and moved on to the next critical patient. During the next 36 hours, as the earthquake crisis continued, Sofia transformed chaos into order. She established military triage protocols, rapidly trained staff in diagnostic techniques without advanced equipment, and performed life-saving procedures using improvised methods that left the Elysium surgeons dumbfounded. When a group of children arrived with multiple traumas after a school collapse, it was Sofia who correctly diagnosed a splenic rupture in a girl whose symptoms baffled the other doctors. How did you know it was the spleen without an ultrasound? Asked Dr. West, now visibly impressed. Positive Kehr's sign, postural hypertension, and the specific location of the pain. Plus, her lower lip is turning bluish, a sign of advanced internal bleeding, Sofia replied while prepping the patient for emergency surgery. I learned to trust my eyes and hands when I didn't have machines. 3 days after the earthquake, with the situation finally stabilizing, Dr. Pierce called an emergency meeting with the entire medical staff. The auditorium was packed, not just with the core team, but also with nurses, residents, and technicians who had witnessed the extraordinary events of the past few days. Pierce took the stage, his lab coat now wrinkled after days without proper rest. Beside him sat Mr. Harrison, the oil tycoon, in a wheelchair, recovering remarkably well from his emergency surgery. Ladies and gentlemen, Pierce began, his voice tired but firm, over the past few days, we have witnessed something extraordinary in this hospital. When we lost our sophisticated equipment, our state-of-the-art facilities, and our ability to follow meticulously crafted protocols, when we were reduced to basic medical practices, we discovered that medicine isn't in the machines. He paused, meaningfully, looking directly at Sofia, who stood at the back of the auditorium. "Dr. Sofia Mendes, could you please come up here?" A respectful silence filled the room as Sofia walked to the stage, still wearing her worn lab coat, with improvised patches made during the crisis. This doctor saved 47 lives in the last 3 days, using techniques many of us considered obsolete or unsuitable for a hospital like Elysium. She turned our shortcomings into learning opportunities and our panic into coordinated action. Mr. Harrison took the microphone. "I would be dead if it weren't for this extraordinary woman. My lawyers inform me that no other doctor in this hospital would have attempted the procedure that saved me. Dr. Mendes didn't just save my life. She changed my perspective on what truly matters in medicine." Natalia Kovic stood up. "As head of the surgical oncology department, I would like to publicly acknowledge that I was wrong about you, Dr. Mendes. Your diagnostic skills surpass anything I've ever seen, and your practical knowledge of anatomy is phenomenal. I learned more watching you these past 3 days than in 5 years of fellowship at Harvard." Dr. Ramsey was next. 42 years in my career, and I've never seen anyone perform an emergency pericardiocentesis with such precision using only a stethoscope as a guide. 73% of patients with traumatic cardiac tamponade don't survive even under ideal conditions, yet you achieved a 100% survival rate during the crisis. Pierce took the microphone again. "That is why, with the unanimous approval of the board and the generous contribution of Mr. Harrison, we are announcing the creation of the new division of trauma and disaster medicine at Elysium Hospital, to be led by Dr. Sofia Mendes as senior director." The entire room burst into applause. Sofia, visibly moved for the first time since her arrival, simply nodded in acknowledgement. 6 months later. The new training center at Elysium Hospital was impressive for its functional simplicity, which contrasted with the luxury of the rest of the complex. In a large room, dozens of doctors, including the previously skeptical Dr. Ramsey, Dr. West, and Dr. Kovic, watched intently as Sofia demonstrated diagnostic techniques without sophisticated equipment. "The most powerful medicine comes not from machines but from keen observation and deep knowledge," she explained, now wearing a new lab coat but still carrying her worn stethoscope as a reminder. "When you lose access to technology, and it will inevitably happen at some point in your careers, your senses and your reasoning will be all that stands between the patient and death." On the room's walls, framed photos showed Sofia in various conflict zones around the world, working under impossible conditions. Beside them, a new photo showed the entire Elysium team during the earthquake crisis, working in harmony under her leadership. Dr. Pierce entered the room, accompanied by a group of international investors. "As you can see, gentlemen, Dr. Mendes's program has completely transformed our hospital. Our trauma survival rate has increased by 32% since its implementation, and doctors from all over the world are applying for our new fellowship in disaster medicine." Sofia smiled discreetly as she continued her lesson. At the back of the room, Dr. West watched with admiration. Hospital rumors suggested he and Sofia had started seeing each other outside of work. His initial arrogance replaced by genuine respect and admiration. At the entrance to the new training center, a marble plaque bore a quote, "True medicine lies not in the machines, but in the experienced hands and prepared minds that operate them." Colonel Roberto Mendes, MD, Elysium Hospital, remained a symbol of luxury and exclusivity for the rich and famous of Beverly Hills. But now, thanks to a former military doctor whom no one had taken seriously, it was also recognized as a center of excellence in practical medicine and innovation in the science of saving lives, with or without cutting-edge technology. The doctor who was once rejected for not fitting in was now the person everyone aspired to be.